Hi, good evening, everyone, and welcome to tonight's COVID-19 Community Town Hall Series, which is presented by UP Health System Portage. I'm Steve Elmer, a college professor here at Michigan Tech University and a member of the Health Research Institute. We want to welcome all of our guests and community members that are joining us tonight on our Zoom webinar on Facebook Live. Also those that are listening on 97.7 The Wolf and 99.1 WIKB down in Iron River. It's great to have you with us tonight. Anyone joining us in a couple of days on our YouTube recording or our TV recording, it's great to have you with us as well. Just a couple of announcements before we get into tonight's topic, which will focus on summer activities during the pandemic. We have a great lineup of speakers here tonight, and we'll introduce them momentarily. Our sponsors for this series include the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, the Physiological Society, and once again, our presenting series sponsor, UP Health System Portage. Tonight, we're really excited to introduce a new partner. We have support from the Michigan Health Endowment Fund, so we appreciate their support in helping guide our town hall series throughout the pandemic and beyond. So it's great to have them with us. I want to emphasize that the town hall series is organized by the Health Research Institute. Their mission is to support health-focused research here for our scientists and engineers, health-focused education for our students and training, and finally, health-focused outreach for our rural Upper Peninsula community. The goal of each town hall is to increase our awareness and keep us informed about all things COVID-19 and how it impacts our health and the health of our society. So far, we've had a broad range of topics. We've learned about the role of public health in protecting the community, about vaccine development, the vaccine rollout, how the pandemic is impacting our physical, our mental health, and our well-being, and many more topics in between. All of our town halls are free. They're publicly available. You can watch those on our YouTube channel. The best way to access those is by going to our website, which is mtu.edu/health-research. Once you're on the page, go ahead and click Town Hall up at the top. You'll be able to pull up all of our town halls. If I didn't mention, tonight is our 18th town hall since we started back in September. One other announcement, we'll have our TV rebroadcast this Sunday at 12 p.m. Eastern. I know on the screen it says 11:30 a.m., but it's 12 p.m. as we're working through the NBA basketball playoffs. So please share this with family and friends that might want to tune in who don't see the live recording tonight. One other quick announcement. I normally am working with my colleague and co-host, our epidemiologist, Dr. Kelly Kam. Dr. Kam is off tonight, so I'll be running the show. So Kelly, we'll see you at our next town hall. Dr. Kam did want me to emphasize just one main public health update for our audience. As many of you know, this week our state health department has rescinded the majority of state health orders. So the capacity for indoor and outdoor settings is back to 100%, and masks are no longer mandated statewide. So this is a great week. We're looking forward to many of our summer activities, and that really frames up our topic for tonight, which we'll be focusing on moving forward this summer with activities for our kids, for our students, athletes, and also providing some perspectives from abroad as well. The other thing that Dr. Kam wanted me to emphasize is that our public health experts are working to protect our health. They're keeping a close eye on the different variants of the coronavirus. Many of you probably have heard of this Delta variant that's circulating. So next time we're at the town hall later this summer, Dr. Kam will report back on that. And she's finally encouraging everybody to get vaccinated. If you have questions about vaccines, talk to your primary care provider at Aspirus, Upper Great Lakes, UP Health System Portage, or even your local pharmacist. So next, I'll go ahead and welcome in my colleagues for tonight. If you give me just a minute here, I will go ahead and pull up my camera here on Zoom and meet the group. So just a second here. Here we go. Hello, everybody. If you can give a quick wave to our audience. We have a great lineup of speakers. I want to introduce everybody here, and then we'll get started with our discussion. So we have Cassie Tafta-Munoz, who is the Director for Educational Outreach here at Michigan Tech. Good evening, Cassie. We also have Mr. Nate Larson, who is the Assistant Athletic Director for Sports Medicine here at Michigan Tech. So good evening to Nate. And then we have Ms. Karuna Rana, who is a Michigan Tech alumnus, a Fulbright Scholar, and joining us from, I believe you said Philadelphia today. And you'll be providing some international perspective from your home country off the east coast of Africa. So a great lineup of speakers, and we'll go ahead and turn it over to Cassie, who just remind everybody to unmute when you're speaking. And we'll get started with Cassie. First, Cassie, I wanted to say welcome back to the town hall. You've been here last fall. For folks that don't know, Cassie's really been instrumental in helping us get the series really off the ground last August and September. And so, Cassie, we do appreciate the support from your center, and we're looking forward to hearing more about some of the challenges, solutions that you work with outreach, and then most importantly, how things are looking this summer. So welcome back.
Awesome. Thank you so much. It's very different here June 2021 than it was last time I was here in September, Steve. So thank you. So yeah, my name is Cassie. I'm the director of the Center for Educational Outreach here at Michigan Tech. And our main mission, we like to say, is to spark curiosity, try to keep it short and simple. Really what we're here to do is help kids discover possibilities for their future. Those could be educational or vocational or otherwise. And the nature of outreach is that things are always changing, but certainly during a pandemic that can be exacerbated. The variety of our programs that we offer have in large part been really large scale events. We have a program called Mind Trekkers. We travel nationally and put on many thousand people events. And of course, that's not something that's been possible now for about 16, 17 months. And then of course, we're really well known for our summer youth programs as well. And so I was going to talk a little bit about that tonight. This week actually is our very first week of our summer youth programs. We brought students here on Sunday for the first check-in in 687 days. And so to give that some context, Michigan Tech summer youth programs have been running since 1972. And we did not run programs last summer. And one of the things that I wanted to talk about on the panel tonight is what we're sort of seeing in our first few days of working with students when they're sort of re-immersing back into these sort of social normalcies again. And so with that, just another little description here. Planning for running programming has been really challenging. I'm sure, Steve, we may talk about that a little bit more in the panel. The summary is things change every hour and you have to be ready for that. But I think the deeper story really is that, for students, we're seeing a lot of challenges readjusting back to being with other students their age. This week, we've seen, a lot of personal triumphs. We've seen a lot more anxiety as well. We've seen students really struggling to understand rule boundaries. And that might be, because they've had energy drinks. And that also may be because, they just haven't really had a lot of those bounds reminded to them over the last year and a half. So anyway, what we're seeing so far with students is it is great to have this return to normalcy as much as we can. Our kids really need to have these experiences again. But there are many challenges. And what we're trying to do as educators is really help students acclimate back into sort of a fun and memorable summer that is also educational.
Thanks, Cassie, for helping us kick off the discussion. I'll lead in with a question here. I know with outreach in your summer youth camps, the focus really is on hands-on learning, hands-on experiences. I'm wondering first if you can comment on, students didn't get that last summer. So as they're coming in, I know it's really early, but how do we catch them up on the experiences that they missed out over the past year, specifically with some of those hands-on skills that you're trying to foster in those hands-on experiences?
Yeah, for sure. So first of all, I mean, many schools, the majority, and if not all, at some point went virtual, right, with programming. And what is missing from virtual programming, and actually in a virtual environment, everything is very controlled. Your classmates are on mute. You're looking at one screen, one teacher, one face, whatever. You don't have like flies buzzing around the classroom or, noises in the hallway or whatever. So, school in a virtual environment is very controlled, first of all. Second of all, with those hands-on pieces, you just really can't recreate those in a virtual environment. There's a lot that you can do with simulation, but it's not like somebody put something in front of you and you have to kind of just dive in. And so I think what we're seeing is actually, the impact of the loss of those hands-on learning pieces is less so the learning and more so the confidence in being able to jump into the learning. And that really only happens when you're physically surrounded by your peers and they're all doing something, and that gives you confidence that you can do it too. And you just don't get that necessarily virtually.
I want to follow up with a question. You just highlighted some of the limitations to the virtual experiences. could we flip it around? Have there been any advantages while over the past year? And then moving forward, do you envision any combination of hybrid where there's an in-person and a virtual? I'm just wondering if you could speak more to that.
Yeah, absolutely. So we, of course, like, many other entities, we developed a whole range of virtual programming over the last year and a half. And, you know, Zoom fatigue was real. We were having a hard time getting enough people to join us for virtual activities and events in November and December of last year. And I think that was predominantly because people were just tired of looking at screens and being on screens. And the thing about virtual is that you really reduce, especially for a place like Michigan Tech. We're an amazing university. We have wonderful faculty, really high quality experiences and academic output here. But we, as I like to say, we are not on the way to anywhere. You don't just drive by Houghton. You sort of like have to be in a car and like intentionally come here. So for us, actually, virtual environment really was the geographic leveler. It suddenly was, it put us on the same playing field because what was at the heart of what we do was our content and not the travel time that it took us to get somewhere. And so from that standpoint, we've been able to bring in really incredible guest speakers for students, really removing some of those traditional boundaries of being able to talk to a CEO at a company somewhere over Zoom that probably might not fly to Houghton normally, and things like that. So certainly many opportunities in the virtual realm that way. Would be remiss to not talk about access as well. Now, access virtually is still a great issue. Not all students have devices, have internet. In our region particularly, even self-service to be able to use internet. But when you can sort of bridge those gaps, it does provide students a much quicker door to get to content that is more low risk for them. So for example, it's maybe it's less intimidating to hop on to a I don't know, some sort of hands-on activity online about mechanical engineering than it is to like physically sign up for that after school, and go and show up and have people look at you and that peer pressure. So in a lot of ways, it increases access across the board, and that's been fantastic.
I see one more question and then we'll move on, but we will have some time to come back to you. Can you just talk about the age range of kids coming to the summer youth programs this summer, and then the differences between those 12 and older that are eligible and able to get a vaccine and those aren't?
Yeah, so for our programs, students have to have completed 6th grade. So that means most of our participants are ages 11 through 17. And I think really, we do not require vaccination in order to attend our programs. However, we do have an optional question that parents can answer if they'd like to let us know if their child is vaccinated or not. And actually, I'm really quite proud to say we were just looking at that really early data there. And right now, the overall vaccination rate for students in our program is over 65%. And that's actually higher than the state average overall. So I think that, we do see that vaccination, at least with the students who choose to come to our programs, is a high priority for many families. Those who've been able to get it have chosen to do so. We have had students, even in this first week, that have left camp programming during the day to be able to get their second shot and things like that. So overall, I would say that there has been a really notable difference for us and participants wanting to be vaccinated and to fully immerse back into normal life, so to speak.
Okay. Thank you, Cassie. We're going to just pause here a second and welcome any new listeners or viewers that just might be joining us, especially those radio listeners. If you're out on 97.7 The Wolf or 99.1 WIKB, if you'd like to join us and see some of the visual content, a good way to do that is you can head on over to thewolf.com, click on the respective links to join us on Zoom here, or you can join us on Facebook Live. Our topic tonight is focusing on summer activities during the COVID-19 pandemic. We just heard from Cassie Munoz, the Director for Educational Outreach here at Michigan Tech, and we're going to move on to our next speaker. We're going to welcome in Nate Larson, who is the Assistant Athletic Director for Sports Medicine here on our campus. So Nate, welcome to the Town Hall platform. We appreciate you being here tonight. Tell us a little bit more about how the pandemic has impacted our athletes, our student athletes, and what the forecast is looking like this summer compared to last.
Wow, where to start, right? Like Cassie said, she is hands-on learning also with us in athletics, and and with our student athletes, we are definitely hands-on learning. We would not be able to function without hands-on and in person. So in the past 15 years, a lot, I mean, wow, a lot has changed, right? So our jobs, I also am an athletic trainer. And so there's 3 other athletic trainers that work up here in the sports medicine department. And our jobs have kind of shifted a little bit from the normal injuries and illnesses to kind of like a frontline essential worker, basically, and taking care of this pandemic. However, our student athletes' health, safety, and well-being continues to be our top priority. So, with some of those new job responsibilities that we've had in the past 15 months, include lots of different policies, procedures, right? And they're constantly changing. Making return to campus plans, making return to sports plans, the actual physical COVID testing we've done. Between myself and the 3 other athletic trainers, we've done over 15,000 tests ourselves. That's both PCR and antigen testing. We've done a lot of contact tracing, helping the health department, helping Kelly Cam, and just kind of reaching out to them because we have a little greater knowledge of who's living with who as far as the athletes, and we can kind of track those people down faster than the health department can. So we've done a pretty good job with that, being a liaison between the local health department and Kelly Cam, who has been a wonderful, great resource for us here at the university. Returning to practices and game coverage, and then continued planning for summer camps that we've had so far, are continuing to have the rest of the summer, and then into our fall sports that will be starting up here in a couple months. So I want to send a huge thank you to especially Dr. DeYoung, Kelly Cam, Suzanne Sandergret, Joel Isaacson, Sarah Dowd, and all my fellow athletic trainers, coaches, student athletes here, numerous other people that I will forget. So I'm thankful for all their help getting through this. So in athletics, we take guidance from our local health department, Michigan Tech Flex, state agencies, the CDC. However, most of our guidance has been taken from the NCAA Sports Science Institute. And the Sports Institute consists of doctors, team physicians, athletic trainers, many other healthcare professionals that volunteer from over 1,100 colleges and universities across the country, as well as groups of small committees that set association-wide policy. So the NCAA Sports Science Institute conducts lots of research in many different areas. They provide data to help develop those association-wide policies. The committees manage topics affecting sports rules, championships, health and safety, among many other topics. So from these committees, the mental health side of things has definitely been a forefront topic of discussion. The pandemic has taken a huge toll on all of us, not only our student athletes, but our administration, staff, coaches, everyone. So we're continuing to monitor the mental health side, the mental health of our student athletes now more than ever. And Sarah Dowd really helps us with that. She is the director of our student athletes wellness, and she's also a clinical counselor on campus here. So things we've done, like our coaches have really helped be really positive with their student athletes. They really try to celebrate even the small steps as we've come along this long road. So once we could finally get back even in the building, celebrate that a little bit. And I don't mean celebrate together, because we still keep our distance and all that stuff. but just making it a priority and getting the student athletes excited again, getting back to practice, getting to finally play games or competitions. So it's been really good. So our student athletes have done an excellent job following these guidelines and really isolating themselves from the general public and keeping themselves safe. So as I said before, we've performed over 15,000 COVID tests since this whole thing started, and we've had roughly 150 positive cases, so roughly 1%. And most of the cases that we've seen have been from living situations or living arrangements, and not actually from the workouts, practices, competitions, stuff like that. So we continue to change policy and guidance now as information emerges and comes to us, to give our student athletes the best chance of competing competitively, but also as safe as they can.
Okay, thank you, Nate, for that comprehensive overview. You did cover a lot there. We're covering about 14 or 15 months. So thank you for bringing us up to speed. Just want to remind folks, if you do have a question, there's a couple different ways to send those in. If you're on Zoom, you can use the Q&A button at the bottom. If you're out there on social media or listening on the radio, you can send it to townhall2020@mtu.edu, a couple different ways. And thank you for those that sent in your questions earlier this week via email. So Nate, going to lead in with a question here. Can you talk a little bit about athletes, sort of the start and stop nature? If you had to go into with contact tracing and if they were infected with COVID-19 and then resuming kind of the return to play. And really what I'm getting at here is I'm wondering about injury rates when athletes have to take a break and then come back. You mentioned you're an athletic trainer as well. So are we seeing more injuries over the past year with our student athletes and athletes? And just a little bit about that start-stop intermittent nature.
Yeah, the start-stop has definitely been really frustrating, not only for us and our staff, but also for the student athletes themselves. And especially when we get one positive case and the whole team is shut down. It's for a couple weeks, and then they're trying to get back in and get back in shape, and so it's definitely been a challenge. But yeah, so it's definitely been a challenge. And what was the second part of your question, Steve?
I'm just wondering, Nate, if you could talk about the injury rates with that starting and stopping, and you're saying missing time, shutting down. Are you seeing more injuries, with our student athletes, if those have changed compared to, prior to the pandemic?
We have not seen a rise in injury rates here at Michigan Tech. I know other sports, other levels of competition across the country, there have been higher injury rates, but we have not seen that here so far at Michigan Tech.
Next question here that's via email, talking about this concept of a bubble. You mentioned that in order to stay safe, the athletes had to really be isolated from friends, family, other students on campus. As we move forward, Nate, are there any advantages to that bubble approach as we move forward in the pandemic? I don't know if it's distractions or more focus or keeping them safer. Can you just comment on this bubble approach, and is there potential for it to be used in the future?
I hope not. Yeah, the bubble approach, we've done it just basically to stay safe, just so limit contact with anyone and really try to just stay within a small group of people, teammates, households, and stuff like that, and just really try to limit spread of anything, COVID plus anything else. So I think going forward, it would be a good thing to also, bubble, if that's the correct term. I mean, it's not like the bubble in the NBA or the NHL, per se. Like, we're still out in the general public here. But I think going forward, it's definitely helpful.
Nate, one more question, and then we'll move on to our third speaker for today. We talked over the pandemic, a lot of kids missed out, kids and college students and athletes have missed out on opportunities to compete and play in sports. Kind of similar to what I asked Cassie, how do we make up for those missed experiences last summer, whether it's this summer or moving forward, that depending on where kids and college students were, it could look different, right? Not everybody was on the varsity hockey team where we had, a lot of support to help keep them playing a varsity sports, if it's intramural sports or other club sports. Can you just comment on, what can we do, I guess, collectively moving forward?
Yeah, with our sports here at Michigan Tech, all the student athletes get an extra year basically of competition. So they're really not losing out on a whole lot because they can gain that year if they choose, or if the team chooses. But yeah, that's obviously going to be different with high school kids and even middle school, younger kids that are coming into our camps this summer. It's really tough because they lose that year. Even my son is in baseball this summer, and you can definitely tell from playing 2 years ago and missing a full year last year. Every kid is a little bit behind, and from where they should be or where they want to be, and it's tough. You just try to encourage them as most you can, and try to be as safe as you can.
Great, thanks, Nate. One more question here via email that came in. You talked about, both you and Cassie talked about the impact on mental health. Cassie for K-12 students and you for athletes. Nate, can you just talk a little bit more, to what extent has that really manifested with varsity athletes? I think, certainly we know that they're very focused, they're balancing academics and athletics, but how much of an impact do you think that's had? And again, is that something that you see those students dealing with long-term, or are they able to bounce back pretty quickly as they move forward?
Yeah, there's definitely been an increase with kids, and they're coming to you and because they just need to talk, right? They need to talk to somebody, and they want somebody to listen to them. And so we do that a lot. And so we do our best. If they need referral, we get them to where they need to go. Sarah Dowd is a huge asset to us here in the department. And so we're more than welcome to send them her way, and we get them the help that they need. But there's definitely been an increase in the incidence of mental health.
Okay, great. Nate, we'll come back with a few more questions in a little bit. I want to welcome in our next speaker, our third speaker today. We have Ms. Karuna Rana, excuse me. She is an MTU alumnus. She is a Fulbright scholar and also an environmental activist. So Karuna, welcome to our town hall. We really appreciate you joining us, and just tell us a little bit about yourself and where you're from and the connection with Michigan Tech. And I know you're going to provide a little bit more of a sustainability and also an international perspective, as things can certainly look different here from county to county, state to state, and country to country. You're our second international speaker that we've had on the town hall. So welcome, and I'll give you the platform.
Thank you, Steve, and thank you to the other two panelists. Well, thank you for having me. And speaking of summer activities, I have to say that I absolutely miss the beautiful summers of the UP. So I had to start with that. So I graduated last year and from Michigan Tech, and I graduated in environmental and energy policy. But I actually got to Michigan Tech in 2020 under the Fulbright Scholarship Program. And so I come from a country called Mauritius, which a lot of people in the US haven't heard of. So I always have this ready when someone asks me, what is Mauritius, and where it is. Well, Mauritius, to put it very simply, is a tropical island. What you think, what Barbados or what a Caribbean island or even Hawaii would be for many Americans, that's what it would be for a lot of tourists in Europe, for example, or Asia. So Mauritius is a tropical island. off the coast of Africa. We have a population of 1.3 million people, so it's pretty big for an island. It's really beautiful. I would really advise you to look it up on Google, and I'm sure you would be adding that to your bucket list. I promise you, it would be worth the flights. So yeah, we're a population of 1.3 billion. I think the closest we are is to Madagascar, but even that is 2 hours by flight. And if you talk of the mainland Africa, it's a 4-hour flight to Kenya or South Africa. But we're very much part of the African continent. A bit about myself, as I said, I graduated last year. I've worked in the environmental space for nearly 10 years now. I had my own nonprofit before I moved to the US in 2020. And right now, under the Fulbright program, I am currently working with Lollyware as the head of sustainability. So very quickly, Lollyware is seaweed-based climate tech company using seaweed to replace plastic. So it's pretty exciting. It's aligned with what I do and what really matters to a country like Mauritius, everything to do with climate change, oceans, and using ocean solutions to tackle climate change, but also provide employment opportunities to coastal communities. So that's a bit about me. I think what I would like to touch upon today is giving a perspective, an international perspective, specifically from a very unique country like Mauritius, which heavily depends on tourism. So, speaking of Africa as a whole, we'll start with that. Just prior to COVID, Africa had the second fastest growing tourism sector in the world. It represented 8.5% of Africa's GDP and employed around 24 million people. Unfortunately, in 2020, that number of international tourists arriving in Africa fell by 98%. So you can imagine how hard that must have been for a lot of countries that rely on it. Now that things are slowly recovering, obviously it's different from country to country, whether you're looking at Africa or the world. The demand is not expected to reach pre-COVID levels for tourism in Africa before 2023. That's both for Africa, but also Mauritius. Moreover, it's very important to highlight that the pandemic has severely affected employment, and specifically sectors where women's employment is very, very high, such as hotels and restaurants. So, as a result, a lot of the tourism-dependent economies in Africa have been estimated to experience very sharp declines in growth. And Mauritius is one of them, obviously. As I said, it's a very big tourist destination. We welcome around 1 million tourists per year. Actually, it's even more. It's between 1 to 1.5 million tourists a year. Most of them come from Europe and Asia. So it's a very big part of our economy. It actually contributes between 20 to 24% of the GDP of Mauritius and accounts for 20% of employment. Unfortunately, when we look at the numbers now, as I said, there've been a very sharp decline. So, from 20 to 24% GDP contribution from the tourism sector, it went down to only 8.7% in 2020. We've had way less tourists in Mauritius, obviously. And also, while I'm telling you how it has impacted Mauritius, it's also very, I think it would be very interesting to share the COVID journey rather, of Mauritius, because Mauritius has handled COVID-19 in a very, very unique way. So we had the first wave hit us around the same time as the rest of the world. It was around March, April of last year. And Mauritius was very, very swift to take action. We had one of the most stringent lockdowns in the world. When I say we had a lockdown, it was lockdown in a way that you couldn't even go outside to walk. It was that stringent. You could go to supermarkets, but they were based on alphabetical orders. So, for example, when I was talking to my mom, and we had also a lockdown at that time. I was in Michigan, and there was also a lockdown in Michigan. The lockdown of Michigan and Mauritius was so different because I would, based on what people are allowed to do in the state, for example, I could go out for a walk, I could go for a hike if I wanted, but that was not the case for my mother, for example. She was complaining that she has to be in the house. It was very stringent. It affected, obviously we're speaking of mental health, it affected mental health of a lot of people. And, a lot of sectors were very, very impacted by that. But because of how stringent this was, and this went on for a couple of months, Mauritius became COVID-free in a few months and actually had a full opening in October, including opening it up to international travelers. So Mauritius was actually one of the first countries to be considered COVID-free, and it even obtained a label of safe destination by the World Travel and Tourism Council. So that worked really well. Unfortunately, just a couple of months ago, Mauritius was hit with a second wave, not as bad as the previous wave, but again, Mauritius learned from the previous experience and was very swift to take action. So currently there is a partial lockdown happening, and it's slowly opening up as vaccinations rate are slowly increasing and cases are going down. But what does that look like in terms of, tourism or, international traveling, or even for me to be able to travel back to Mauritius? It's still very restricted. The first phase of opening of the island in terms of the borders is happening on 15 July to 30th September. And we call this the first phase of opening. And they will be only allowing vaccinated tourists to enter the country. And even if you're vaccinated, you will be tested upon arrival and at 14 days. And then if you're unvaccinated, well, you're not allowed unless you're a Mauritian national until the 30th September. So it's only for Mauritian nationals. And then we would have to do a 14-day quarantine. And a quarantine is very different from what a quarantine looks like here, for example. It's not a self-quarantine. If you go to Mauritius and you have to quarantine, there are a list of officially designated hotels that you have to pick and very often pay for yourself, and based on the different levels of hotels that are available. Some could be cheaper, some could be more expensive. So you have to do this if you're not vaccinated. And then as from the 1st of October, it's going to be a full opening of the country. But again, if you're vaccinated, you're good to go. But if you're unvaccinated, you would still have to do this 14-day quarantine. So as you can see, it's very different in terms of how Mauritius handled COVID and how it was impacted. And I can talk more about it, but I'm sure you have questions.
Thank you, Karuna. I just want to take a brief pause here. We're about halfway through our COVID town hall. We'll follow up with some questions here in just a minute. I want to recognize our presenting series sponsor, UP Health System Portage. Just let folks know, if you're just joining us, our topic tonight is focusing on summer activities during the COVID-19 pandemic. I think we got a really diverse panel here, a couple of local speakers, and right now we're talking with Karuna Rana, who is from the island of Mauritius. She's talking about tourism and also in the context of traveling there and how life is on the island there. And so I'm going to lead in with a question here. Can you speak a little bit more about vaccines for the local people, your population there? What percent are vaccinated, the vaccine rollout? How is it? Can you maybe compare and contrast to give our audience a little perspective of what we're used to here and what's going on back in your home country?
Absolutely. It's very different. So I don't have the exact numbers, but I know it's between 20 to 30%. So between 20 to 30% of the population have been fully vaccinated so far. And obviously this is very different from the US. I know it's when we talk about vaccination, it's such a sensitive topic and could also be a very controversial topic when it shouldn't be. But I want to highlight that me being in the US has really opened my eyes to vaccine inequality, because very often when I'm talking back to my parents or friends back in Mauritius, it's a totally different story. They were very amused when I was able to get my vaccine. I think it was like 1 or 2 months ago, and they were very amused that I had the choice to pick between this vaccine or the other one, and I was doing my analysis and picking which one would be the best one at that time. They were very, very amused by that, because the case in Mauritius is very different. Obviously, we received donations and vaccinations from some countries. And it was open only to certain age populations, and even then it was very restricted in terms of the numbers. One example is my mom, who got vaccinated. It was a first come first served basis, and they had a camp set out for vaccination on that day. And she told me she had to go there in the morning at 7 o'clock and wait for 5 to 6 hours in queue to be able to get the first vaccine shot. And this is so. It was very different. It opened my eyes to how privileged I am right now to be in the US and have access to the vaccination. So this is something very important to highlight. So vaccination is going to be very key for a country like Mauritius. As I mentioned, Mauritius is opening up its borders, but the way it's opening up its borders is going to be very different for vaccinated guests versus non-vaccinated guests. If you're vaccinated, you're good to go. But if you're not vaccinated, you have to take a 14-day quarantine even when the island is fully open. And that quarantine is not a self-quarantine. It's going to be one of the designated hotels. Obviously, this is something that the government is deciding for right now because we're a small country. We have to protect our population. It may change, as the world is starting to adapt, as the population becomes more vaccinated in Mauritius, but also the world is starting to live with COVID. We know it's not going to go away. I'm sure that the government will adapt accordingly because the tourism industry has been hit very, very hard. And one of the key priorities in Mauritius is to improve on that front and be able to welcome guests again.
Karuna, I think you bring up a really good point about traveling to places. I want to give a plug in there for our audience here. If you are planning to travel, especially across the country and internationally, the CDC website has recommendations for those that are vaccinated, unvaccinated. If our colleague, as Nate mentioned, Kelly Kam, our epidemiologist, would have more guidance on that, but she's off tonight, but she would recommend that we check the CDC website for that for up-to-date information. They have I was on there today, they have a nice infographic, a checklist, certain things that you need to follow, and you can also check, I looked it up, Mauritius today, if you were planning to travel there, you can see, are you allowed to travel there? If so, it prompts you to additional resources. So I wanted to lead in with another question here. I know your background is in sustainability, so I'm wondering if you can speak to, has the pandemic, and we talked about this a little bit before on the town hall, from your perspective, sparked renewed interest in the concept of sustainability? Could you speak to that a little bit more?
That is very interesting. From my perspective, I would say it has sparked more interest within people who are already working in this sector. And, I think it has opened our eyes to how important the link is between sustainability and pandemics like that. Unfortunately, I would say for a lot of the rest of the world, who are fighting like the second wave, for example, or having to, shut down economies and being very hardly hit because of that, it's difficult. It's difficult to think about sustainability at that time. And I would say, unfortunately, when it comes to plastic pollution, so that's the area I work in, for example, plastic pollution has been at one of its, worst. We have been using way more plastics. If you look at the takeout containers, we've been using a lot more throwaway culture, a lot of bans that were made on plastic bags in a lot of states, they were canceled temporarily so that people could start using plastic bags again. I looked at some numbers, I don't have them in mind right now, but I do know that a lot more plastic have entered the ocean. Recycling was also, the recycling industry was affected a lot. So that, in a lot of countries, as the economy is shut down, it affected recycling. So in terms of, the plastic side of things, it's not been really good for the industry. And this is what, as someone who works in this sector, we've been very baffled by that. And, which is why I'm really excited to be working with Lawlyware as we come up with an alternative to plastic, which is seaweed. And the reason we're also looking at seaweed is because seaweed, it comes from the ocean. And for a country like Mauritius, ocean resources are very, very important. So I don't know if that answers your question, but unfortunately, it's not been looking good for plastic.
Right. We appreciate it, Karuna. I'm going to open it up here to the panel for additional questions that are coming in here. This question was emailed to us. This is for Cassie. This is a parent asking, my child is going to summer camp later this year. What can I do to sort of help prepare them so that they have a better experience come next month when they're going off, like you said, interacting with kids more than they've done so in the past year? If you have any recommendations or advice for parents.
Yeah, absolutely. So some of the things that we've seen this week. So again, our check-in day was on Sunday. That's when the majority of our students came. And I should say too that pre-pandemic, a typical summer for us was about 1,100 to 1,200 students. And in order to open this summer, of course, with all of our risk mitigation and other policies, we actually started out with a reduced capacity by about 400 seats. Even still, we're expecting 900 students this summer. So that is literally at capacity, at our reduced capacity, which is to say that we're glad that a lot of families are feeling like this is an important opportunity for their kids, and they are willing to take additional safety measures. As of today, we are no longer requiring mask usage, but that was just today. And many families were willing to still show up on Sunday and check in their kids with masks. We also require some COVID testing as well, pre-testing prior to arrival, and other procedures. So, you know, honestly, we have asked a lot of families this summer prior to sending their kids, and we're really grateful that families have been so cooperative and understanding. Now, in terms of preparing kids, I will say that I think the biggest challenges are socially, and in a pre-pandemic world, going to summer camp is already a source of nervousness for kids. And who's gonna be my roommate? And what if I don't know anyone? And what if I have to sit alone and eat? Or what does the shower look like? How can I possibly think of going to the showers by myself when what if I don't know how to turn on the water? You know, keep in mind, we're talking about an age range that is really pivotally important developmentally, right? And so I think what's helpful for parents is to really be able to have a conversation with their kids and talk through what a day might look like. Talk through how they might approach going into the cafeteria. What might happen if, you know, they don't see anybody they know at a table. What might be some icebreakers they could use to start a conversation with somebody else. I think a lot of it is those social skills, and that was important before, but I think it's even more important now. And also, my advice for parents actually is consider that for the last 16 months, so many of the decisions about COVID, which have fluctuated and changed a lot, as obviously we've received new information and new data, and guidance has changed from experts and authorities. And all of that really still happened at the parental level, the adult level. Kids weren't necessarily the ones making the choice to put a mask on, making the choice to go virtual for their education. In fact, they've had many decisions sort of thrust upon them in the last 16 months and very little say in their lives. And so you combine that with the fact that many have not been going to in-person schools, and you know, simple things like going to the cafeteria and choosing what goes on your lunch tray. They haven't had those decisions. They haven't been making very small decisions in their lives. They just turn on the computer every day. And so I want to reiterate for parents that it's really important that we help our children feel more confident in taking control back of their lives and making little decisions that all add up to something else. Something that is very interesting for me right now, and this is very anecdotal, just really with a few days of seeing youth again. But you know, one of those big areas, we're seeing a lot more youth exploring gender identities, sexual identities at ages that we didn't necessarily see pre-pandemic. And I do think that a lot of that is related to they've lived now for many months without very many control things over their lives. And now they're suddenly in this space where they're, you know, feeling like a sense of freedom again and wanting to explore a lot more of the world around them. So my advice to parents is really be prepared for that, and you know, be willing to have those conversations, and if nothing else, be willing to open a door to have a conversation with your child that, you know, might be surprising to you or might be uncomfortable for you, because it is sort of just part of the developmental stage, and students are being thrust into that again, and so are parents.
We appreciate it, Cassie, and best of luck with the upcoming camps over the summer. And please keep us posted. Next question here is for Nate. Nate, can you speak to the camaraderie amongst the teammates and athletes? Have you noticed any difference between last summer, or excuse me, a couple years ago, and now going through the pandemic? Has that actually been a positive? Teams have developed stronger connections because they've been together so much and, like you said, kind of isolated, or maybe not so much?
Yeah, great question. I think it's really strengthened the bond between teammates, especially at the college level. They've really gotten closer. They've spent a lot more time together. Haven't been able to go out to places that they normally would, and mingle with others. And so I think it's really brought them a lot closer together and made them a tighter group. Now with the younger kids in the camps, even like Cassie said, just starting this week, and we've had a few camps now going this week, and the kids are back in the gym. They're just so excited to be there. Like it's so refreshing just to see kids running and laughing and playing and screaming and everything again. So exciting.
It is very exciting, Nate. And question for both Nate and Cassie: if parents are interested in signing kids up for camps, can you both briefly speak to that? Are they still able to do that, or are they all filled up for this summer? Nate, maybe we'll start with you and then go to Cassie.
Yeah, I know our basketball camps have closed for registration. Our hockey camps are full for the summer. I do believe there are other camps coming up in July that maybe a soccer, volleyball, they should still be open for participants to register.
And Nate, what's the best way for parents to get information?
They can either call the ticket office at Michigan Tech, or they can go on the website, the recreation website, through the Michigan Tech Huskies athletics website.
Okay.
Go to the recreation side of things.
Thanks, Nate, and just pass it over to Cassie for that same question.
Yeah, absolutely. So we do still have seats available in some of our courses starting that second week of July. So we have seats available still at looks like both the high school and middle school level. So you can go to mtu.edu/SYP for summer youth programs to check out more.
Okay. Next question, I'm going to open this up to the entire panel. I'm going to start with Karuna. If there was the biggest lesson that you've learned during the past 14 months, what would it be, and how would that help you moving forward, whether that's your experience here in the States or your international perspective that you're providing, but sort of the number one lesson that we can take away from this and help us as we move forward?
So I think for me, when I look back and try to compare, the way things were handled in where I was, for example, in the US or, in Mauritius, I can only talk for these countries because those were the ones that I kind of had more an exposure to. I think I would say that really, trust science and science-based facts and make decisions based on that. Whether it comes to COVID or whether it comes to sustainability and climate change, I think we can learn that it's very important to test numbers, to trust numbers and science. I would also say the way Mauritius handled it, obviously, as a smaller country, it must have been, much, much easier. There's no comparison between a 1.3 million population versus the US. But I would say for a small country like Mauritius, which had a very stringent lockdown for a couple of months, it was so stringent, as I mentioned, and probably, a lot of people in the US would have not accepted that form of lockdown. But it really helped in making the country COVID-free. It was a bit of a sacrifice for a couple of months. Again, it's a very different comparison. You can't compare the US versus Mauritius, but I think that was one of the big lessons that I've seen in the way things were handled. And I want this to be applied for, anything, whether it's sustainability or COVID. And then personally, for me, one big lesson would be, and just in terms of how important it is to have an emotional support system wherever you are, whether it's your family, whether it's your friends. This is what kept me going. During the pandemic, I had to move from Michigan to Connecticut for work, and I had to move to a place where I knew no one at all. And it was tough, but I had to kind of rely on myself to meet a few hiking groups, for example, do socially distanced activities, make friends that way. But that is what kept me going, really having that emotional support system of friends and family back home. So
And I just want to interject here with a comment you made about trusting science. We're often reminding our audience members, to look at the websites that are .gov, .edu, .org. There's so much information out there, misinformation. That's one of the goals of our town hall series, is to keep people informed. And if you're not a public health expert or physician, it can be hard to sift through all this information. So I'm glad you brought that up, and thank you again for your ability to kind of switch back and forth between Mauritius and the United States and give us that from a broad perspective. I wanted to pass it over to Cassie. Any lessons that you've taken away personally, professionally, and how can we apply those as we move forward?
Yeah, absolutely. I think that I'm a person with sort of a natural proclivity towards looking for silver linings. And there have been many challenges brought about by the pandemic, but there have also been many opportunities as well. And for us, from a professional context here in our office, pretty much everything that we used to do, we could no longer do for some reason or another. And in that space, we've actually created some really incredible, great new programming. We had the time to sort of do a re-inventory, if you will, of the needs that kids currently have. And that's allowed us to do some projections into the future and see where we need to be or where we need to adapt so that we're meeting new educational needs that are emerging, in the post-pandemic space. So I think that, it's really important to be able to take a challenge and to look at it from a new lens and see what opportunities you could make out of that. And I think that also applies personally.
Okay, thanks, Cassie. Nate, I'm going to give you the final lesson here. We have probably about a minute here, so the floor is yours. Lesson that you can take away and apply as we move forward.
Thank you. I would agree with Karuna. The support systems are huge for personally. You really need someone to talk to, you need close friends, family, and I think that's really important. The number one lesson I've learned probably professionally is that you have to be ready for change, and you have to be ready for it often. And so you can make the best plans that you can, and be prepared to come in tomorrow and have to change those, flip them upside down and start all over. So I think that's the big lesson learned.
Nate, I also wanted to take this minute and thank a former student that just graduated from our program, Jenna Phelps, who I know you mentioned the 15,000 COVID tests that you and your staff have performed. I know Jenna was there helping at vaccine clinics. So I just want to say hello to Jenna if she's tuning in, and thank her and your entire staff for keeping our student athletes safe during the pandemic.
Thank you.
All right, well, we're just about out of time here. I'm going to wrap up and just again thank and acknowledge all three of our speakers tonight, Nate Larson, Cassie Tepdemuñoz, Karuna Rana. Thank you for taking time to come on the town hall. We appreciate all the hard work that you're doing in your respective programs, and you're welcome back anytime in our future. We'll continue this series. Just to let folks know, we will not have a town hall in July, but we'll be back in August, and we'll see how things are looking there as we move forward, hopefully through this pandemic, and look to the future. A couple of final things. I want to recognize our sponsors one last time. Our presenting series sponsor, UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, and the Physiological Society. Once again, our new supporter, the Michigan Health Endowment Fund. We appreciate all of their support, the support of the Health Research Institute, the Center for Educational Outreach, and everybody working behind the scenes. And also shout out to my colleague, Dr. Kelly Cam. We'll see you at the next town hall, Kelly. And then finally, to all the audience members for tuning in to do your part to stay informed. It's not easy keeping up. Things are rapidly changing. I think we had some great discussion tonight, so we're looking forward to the next town hall. A couple of other things, if you missed any part of tonight's town hall, you can watch it on our YouTube channel. It'll be posted in the coming days. That website is mtu.edu/health-research. Once you're on the page, go ahead and click on the town hall. Our rebroadcast will be this Sunday at 12 p.m. Eastern on ABC 10. So thanks for tuning in. We'll see you at the end of August, August 26th, final Thursday of the month. Have a great evening. We'll see you next time.